Hemorrhoidectomy recovery is probably the most difficult thing you will ever have to deal with, and hopefully you don't have to do it more than once if you're in that situation. But there are so many things to keep track of, and it's really hard. I mean, you think that reading all the posts and information online and articles and whatnot would prepare you, but it probably won't. Unfortunately not, because it's very complicated once you're in those people's shoes. You don't know what people are talking about until you live life in their shoes, type of thing. And that's why I coach my patients, because of that reasons. I mean, I've seen it many times, and I can help you and coach and guide you through it. But today we want to talk about fecal incontinence after your hemorrhoidectomy surgery. Okay, so that's leaking poop without your control or knowledge. So you may be going through your days trying to get through it, trying to let time heal things, and all of a sudden you realize that, oh my God, I got an accident in my pants and I didn't make it to the bathroom. Terrifying, right? So let's talk about that today. I'm Dr. Albert Chung. I am a colon and rectal surgeon or proctologist. Same thing. Nice to meet you, and I'm so glad you're here. So I hope that if you're going through this recovery, you have a good surgeon who is supportive of you and is responsive to your questions and anxieties. Make sure I think that's the first thing, number one, that you have a surgeon who is sympathetic and is able to be reached. Okay, that's number one. Okay, so fecal incontinence, like I said, is poop leaking out, or it's even could be to the point of gas leaking out without your knowledge. But the more distracting thing is, of course, poop. Whether it's liquid or solid, you can have incontinence to either one of these textures after hemorrhoidectomy. And it's really, really disturbing, right? Because not only do you have to, keep the drainage from getting all over the place, now you have to worry about poop, like excrement. Oh, I need to wear a diaper then, right? Just a little piece of gauze isn't going to be enough in that situation. Then you worry about, well, can I go out? I mean, what if I have this out in my car or something like that, right? I mean, the thoughts go on and on and on with this situation. So I want to first explain that. Why do we get the incontinence? Well, the biggest reason why is because there is so much damage and inflammation because of the surgery. Like, the surgery is to destroy or cut down those larger hemorrhoids, remove those larger hemorrhoid vessels so that we can level things out, make things flat again, right? But what do? You're cutting and removing out inflammatory insult, number one, and then of course you're putting some stitches in the inside because you don't want to bleed to death. Those hemorrhoids are all blood vessels, and if you don't do something to protect, if the doctor doesn't do anything to protect the patient, who's having the surgery from that bleeding complication, this person could end up going to the ER after a bowel movement because they're pooping out bunches of blood clots. Anyway, so the stitches are there to also protect you, but they cause inflammation and damage because putting a needle and thread through your tissues that's not supposed to be there, that causes more inflammation. So we've got all these forces going on. Everything is it's like a nuclear bomb went off in your bottom end. Certainly does feel that way. But that's only part of the story, right? The other part of the story is that there are nerves that live right at the bottom of the rectum, on top of the anus, so right between the anus and rectum, right? And that area is where surgery is done as well. That's where the very top of the hemorrhoid. And these nerves are, because they're part of the inflammation, kind of like innocent bystander, they will take on a lot of swelling and a lot of injury there as well. And these nerves, their function is to know what is going on. Is there some poop there? Is there gas there? And tell your brain, is it time to go, or can you safely let something slide by, right? Like gas, for example. And in these situations, these nerves, because they're inflamed and kind of messed up, they're hit and bruised up, they are somewhat dysfunctional. They don't exactly do their job well. So that normal sensation that something is there and you gotta hold it so you can go to the toilet, that becomes broken. And instead of you being able to catch things and brain know what's happening, it completely misses that pathway. That pathway is broken, and instead the anus just opens up, functions without you knowing, and then you get an accident. And these accidents are very normal, okay? Very, very normal. And it doesn't matter if you're 20 or if you're 70, it happens to everyone just because of that damage up there. Another thing is you may not be completely incontinent, but again, these nerves are damaged again too, so then you may have other senses of fullness, like you're never done pooping. That's the other kind of version of this problem because of the damage to these nerves, right? You feel like there's always something there, and like you try to go to the bathroom and go poop, you may even strain a little bit because you're so convinced there's something there, but nothing comes out. You may just have some gas, maybe some blood a little bit that comes out, but no poop at all. And in fact, those nerves again are malfunctioning, telling your brain something's there, but there's actually nothing there. So this incontinence symptoms and even that fullness I was talking about, both will get better, to the point that they should both go away, actually, because once things heal from the surgery inside your anus, those nerves will also repair themselves. The swelling will recede, and then everything becomes much flatter and softer again, and you should be able to retain your function afterwards. So if you were not incontinent before surgery, you should become continent again, be able to hold it and then use the bathroom as you once did before. So again, I hope that you have a very supportive surgeon on your hands to get you through these very anxiety-inducing times. But yes, you may need to use a diaper temporarily just to prevent accidents. You may need a Depends or some extra thick pads or extra gauze with you. I think that's the safest thing to do until you feel more confident in your function and in the sensation that you can go out in public and enjoy a nice dinner, go out to a movie, go out to a wedding, and things like that while you're recovering from the surgery. So let me know your questions. Thanks so much for participating and asking this question. I'll see you in the next one. Bye-bye.